Habari za asubuhi. Salamu alaikum ndugu zangu wa bara na Zanzibar. Kila la heri kutoka Chuo Kikuu cha Taifa cha Zanzibar. Karibu. Today I'll walk you through practical guidance for managing heat, ultraviolet radiation, air pollution, and water safety and hygiene risks at mass gatherings, drawing on the recent WHO guidance from December 2025 about mass gathering events. The goal is to make these risks predictable, preventable, and manageable so events stay safe for attendees, workers, and the host community. I'll focus on what to plan before an event, what to monitor during, and what to improve after. Mega sporting events attract the attention of vast audiences worldwide. AFCON, together with UEFA tournaments, ranks second in global viewership after the World Cup and Olympic Games. The most recent AFCON in Morocco reached 2.4 billion television viewers, not only across Africa, but also among African diasporas and their families in Europe, North America, and South America. These events offer exceptional opportunities to disseminate public health messages, to promote healthy behaviors, and to build a lasting infrastructure and capacities for health and well-being. But at the same time, they place host countries under intense global scrutiny, like a magnifying glass, which brings high expectations and demanding standards. Mass gatherings amplify routine public health risks because crowd density, resource strain, and rapidly changing conditions can escalate hazards quickly. Environmental threats, especially heat, air pollution, and UV, can affect large numbers at once, and gaps in water, sanitation, and hygiene can trigger outbreaks. The key message is proactive planning protects attendees and local services while preventing avoidable surges in illness. This presentation is based primarily on recent WHO guidance prepared with the support of FIFA, to which I had the opportunity to contribute during my time at the World Health Organization. We will begin with heat-related risks, what drives them, and who is most vulnerable. We'll then move on to air pollution, covering both monitoring and public guidance. Next, we'll address UV radiation and practical protection measures, followed by essential water, sanitation, and hygiene considerations for large events. We'll also look at workers' health before bringing everything together through communication and planning, and we'll conclude with key takeaways. Mass gatherings combine multiple vulnerabilities, diverse populations, different levels of acclimatization, and limited control over exposures. But what they are also an opportunity, it is to get the systems right, to build lasting capacities in surveillance, risk communication, and emergency response. This isn't only about getting through one event. It is about strengthening readiness for future challenges and building a healthy and lasting legacy. Now we shift into heat. Heat is often the most immediate environmental threat at mass gatherings because it can affect large numbers quickly and overwhelm on-site care if prevention and preparedness aren't in place. Extreme heat increases illness, hospitalizations, and in severe cases can lead to deaths. And it can disrupt operations, transport, and even water and power reliability. Risks rise sharply for older adults, infants, pregnant people, and those with chronic illnesses, and also for visitors from cooler climates who aren't acclimatized. Mass gatherings amplify exposure time, reduce recovery opportunities, and increase dehydration risk, so preparedness and rapid response are essential. Heat vulnerability is medical, social, and environmental. Some medications reduce the body's ability to regulate temperature. Social isolation, low income, and limited access to cooling increase risk. Built environments such as urban heat islands and lack of shade push exposures higher. Occupationally, outdoor workers and athletes are the high-risk groups. For planning, the takeaway is identify and protect those at highest risk. Heat health warning systems work when thresholds are clear and actions are pre-decided. Define alert thresholds using appropriate indexes such as wet bulb globe temperature, which combines the effects of air temperature, wind velocity, humidity, and infrared radiation from the sun or surrounding objects such as concrete and metal. There is need to coordinate with meteorological services and integrate warnings into event operation. Messaging must be actionable, multilingual, and designed for local and non-local visitors. Treat warnings as triggers for concrete steps, staffing, hydration capacity, schedule adjustment, cooling access, and medical readiness. A strong heat action plan has 5 pillars: coordination and roles, early warning tied to operations, targeted public messaging, cooling and hydration infrastructure, and real-time monitoring with rapid adaptation. This is where planning becomes execution and where small operational decisions can prevent large spikes in illness. Next, air pollution. Well, it can be less visible than heat, but it is a major driver for respiratory and cardiovascular impacts, especially when combined with heat stress. Air pollution risks rise when events coincide with periods of poor ambient air quality, for example, smog from traffic or wildfires or waste burning, and can worsen due to the event activities like fireworks, outdoor cooking, and traffic congestion. Key pollutants include fine dust, and this is particulate matter less than 2.5 microns of diameter, ozone, nitrogen oxide, sulfur dioxide, and carbon monoxide. Vulnerable groups include children, older adults, and those with respiratory or cardiovascular disease. The operational point is air quality isn't just the background. It is something the event can influence. Monitoring of air quality should be continuous and easy to interpret. Track key pollutants in real time, translate readings into clear air quality index, and communicate updates across multiple channels. Guidance must be specific: when to reduce outdoor activities, to shift schedules, move people indoors, and protect vulnerable groups. Now, there are drones that can measure and map air quality and heat is in specific locations such as stadiums, fan zones, and surrounding areas. It is important to coordinate air alerts with heat warnings. This risk compound and combined messaging avoids confusion. On the individual side, recommend actions that reduce emissions and exposure without unintended harm. Encourage cleaner transport and reduced idling. Be clear about masking. Standard face covering don't help much for air pollution, like this crowd control Rafiki in Zanzibar on the picture. Respirators like N95 can help when exposure is unavoidable. Reduce the use of motor vehicles. For example, for the European Football Tournament 2024, UEFA has signed an agreement with the Association of German Transport Companies for a 36-hour travel pass available to fans with match tickets in the 10 host countries. Now, UV radiation. It is often underestimated, particularly in Africa, because impacts can feel delayed, sunburns, there is eye injury, and longer-term risks are significant at outdoor events. UV intensity varies by time of day, season, latitude, altitude, and weather, and cloud cover can be misleading because UV can remain high. Outdoor gatherings increase exposure duration, and visitors may be less prepared with protective behaviors. The key message: UV risk is preventable and manageable if we plan around peak times and make protections easy. Three practical strategies. Schedule to avoid peak hours for long outdoor activities. Provide shade and encourage the use of sunscreen, hats, and sunglasses. You can use the UV index in communications and signage to people so that they understand the risks and what action to take. You can keep this guidance simple, consistent, and repeated. Many weather applications for smartphones provide also real-time information about the UV index. And here is the global Smart Sun application supported by the World Health Organization. Now we move to water sanitation and hygiene. If water sanitation and hygiene services or WASH fail at a mass gathering, outbreaks and operational disruption become far more likely. Start with safe drinking water, adequate sanitation capacity, and reliable hand hygiene. Hydration points need to be enough, and safe drinking water should be provided that meets standards, and these hydration points are placed where people actually gather. Toilets must be sufficient in number, accessible, and maintained. Hand washing stations should be near toilets and food areas and stay stocked. Waste management is a direct health issue. Overflow or poor disposal creates immediate risk. Hydration planning can also reduce environmental harm. Single-use plastic bottles create large waste volumes. Refill stations, known also as water kiosks and water ATMs as shown on the picture, are a better default if water quality, of course, is assured. Place refill points at entrances, shaded zones, and high traffic areas, and make them easy to find. Encourage reusable water bottles among attendees, staff, and volunteers. The key is pairing sustainability with safety and reliability. Next, staff and volunteers. They often face longer exposures, heavier workloads, sometimes working against the time, and fewer chances to step away. So protecting workers is both ethical and essential for event continuity. Begin with comprehensive risk assessment that includes all worker groups: volunteers, contractors, and informal workers. Use the hierarchy of controls. Give priority to engineering and administrative controls first, and use personal protective equipment as a last resort when needed. Include basic safety standards such as slips, trips, and falls, cuts, electrical hazards, toxic chemicals, handling of weights, alongside heat, air pollution, and UV. Add training so staff recognize early symptoms and know escalation pathways. Ensure coverage and support mechanisms exist for occupational injury and illness, like the Workmen Compensation Scheme in Tanzania. Now we connect the pieces. Even the best technical plan fails if people don't understand what to do or if messages conflict across channels. Risk communication must be tailored, timely, and inclusive. Messages should work across languages, literacy level, and accessibility needs. Use real-time channels, applications, signage, staff briefings, and public announcements to deliver updates quickly. Build partnerships with media and community networks to extend reach and credibility. The goal is consistency. One coordinated message linked to clear action. This is an example of turning guidance into practical advice. For attendees, hydrate, dress for heat, use sunscreen, and no warning signs. For organizers, provide water, shade, medical checkpoints, and hygiene infrastructure. Also acknowledge venue constraints and promote choices that reduce pollution exposure, like public transport. The point is, safety improves when guidance is simple and actionable. Equity means prioritizing those at highest risk and designing interventions that remain feasible under constraints. People-centered approaches ensure cooling, hydration, personal hygiene, and sanitation isn't limited only to those who can pay VIP zones or arrive early. Practical solutions often look like smart placements, simple infrastructure, local sourcing, and partnerships, not expensive technology. To close, manage risk holistically: heat, air pollution, UV, and water, sanitation, and hygiene risk they interact. Plans must be context-specific to climate, event type, and attendee mix. Multi-sectoral collaboration is non-negotiable. Health, emergency services, organizers, and communications must work as one. Finally, treat every event as a learning loop. Evaluate outcomes, refine the thresholds and messaging, and build a lasting capacity. I hope this presentation will give you some food for thought in your discussions. Let's make AFCON 27 an unforgettable tournament while staying safe and comfortable. Asanteni sana, ubaki salama.